Yeah, I think it's a critical component, and the other part of the health-related aspect of this is that advocate is aware of what the pathways are to resources that can address some of the barriers and issues that may be coming up in the family or with the child. They're not acting as a counselor or a psychologist or a social worker. They are a conduit, a trusting conduit to the kinds of supports that are needed to get individual kids beyond the barriers to their academic success.
We are very fortunate.
Go ahead.
Go ahead, Mary.
We are very fortunate at Wyandotte now with our health career small learning community to have had the opportunity to develop a relationship with KU Med Center, a local medical school here with the University of Kansas. And it took 2 years to do it, but because of our need for supports in our community, we were not a very healthy community in the state of Kansas. But with building a relationship with them and the actual needs that need to be met, we have opened our school-based health clinic here that is run through our health careers community and is actually the capstone experience of our seniors in that community. They are actually getting internships, opportunity in there to work side by side with doctors of what a high school student is allowed to do, deal with a lot of the logistics of the scheduling and of different parts of that program, which is a phenomenal opportunity so that now every student here at Wyandotte can have a health career or a health home, a medical home, and many of them with the dilemmas and roadblocks of transportation and insurances and all of that, they were not getting health care on a regular basis. So we took our structure and the needs of the community, and it was one of the most real partnerships that we've developed in that everybody had a need. Everybody had something that they could contribute as well, and bringing the needs and the contributions together helped us move forward with this. And then that went on to another level because with our needs assessment in our health school-based health clinic, we found out that nutrition, it's not rocket science there, but nutrition is one of our big issues. And so with that now, our hospitality community has partnered with our nutritional services and a few other organizations, and they are offering breakfast in the classroom every day for every student and every teacher free of charge. And so we are finding needs, we are addressing those needs, and then the family advocate that's here is working with the families, the students, and finding out where those services or where things are still not being met, and focusing and magnifying additional needs that we need to be addressing.
In the Madison schools, in the Madison schools, we are just north of Detroit, and as Mary and Wyandotte are in their 15th year, we are in our second year of working with IRRE. First things first. This is our first year, either the second year of working with them, really the first year of implementation of the small learning communities, family advocacy. And what we're finding is as we communicate this to our families, communicate this to our community, what they don't want is another program. They want something that's going to be embedded into our school culture. And the family advocacy group, a component of this, along with the small learning communities, is starting to become a very enticing characteristic of why a family would want to come to our district. As Mary mentioned, what they're doing in Wyandotte, and I'm glad to hear that even though we're in the earlier stages of implementing these strategies, that I feel like we're on the right path. We're also developing a partnership with a local hospital, St. John's Medical Center, to put in a school-based health clinic, hopefully by the end of the year, offering free breakfast this year, the first time to do that, and then also looking to do a free supper program for kids who are in after-school programs, hopefully launching that in the next 60 days. So we're finding that as well, that these kids are in desperate need, not only the kids, their families, and a huge component of what we're trying to do this year as a school in Madison District Public Schools that is a part of First Things First and a part of this entire process is to engage our families, to take the influence that we can have as a school and to hopefully extend that into the home, extend that into the family, extend that into that grandparent or that cousin or someone who needs that medical and health care. And hopefully our influence as a school will have a greater impact on the local community.
Dr. Gracia, there are some listeners who are curious on what's the connection between the determinants of health, the social determinants of health, and disparities. We've heard a little bit about education. Is there a bigger picture that we're not getting from our presentations today? Dr. Gracia, you need to unmute your phone.
Hi, Carter. Can you hear me now?
Yes, I can. Thank you.
Okay, great.
Right, okay.
Yes, I did hear the question. Thank you. So yes, certainly in talking about the social determinants of health, education being an important one, there are other conditions that we can look at as well with regards to access to affordable and healthy food, having access to healthy and safe housing, supportive networks, really taking a broad frame as far as the social environment and physical environment in which people live and where they work and where children go to school. And some of the things that we have seen, what we know that research shows is that when you look specifically at minority or low-income communities, that they may not have access to these healthier communities, healthier schools, and so this unequal distribution of those conditions can be a significant contributor to the health disparities that we see. And so that, I think, is what raises the importance, certainly, of healthy people addressing the social determinants of health and recognizing that it's not only, when you receive care and what happens in the doctor's office or in a hospital that can potentially drive health disparities, but also these broader social determinants of health.
Great. Thank you. And I'm going to throw another question back to Dr. Connell. How does the Institute for Research and Reform in Education help schools determine what to measure with First Things First? How do they measure if their program is successful?
That's a great question. We refer, as you've heard me, we refer to our partners as such, as partners. And as part of this partnership, we bring a set of instruments with us that we have found across the dozens of districts and hundreds of schools that we've worked in have been effective indicators of their progress. We also allow for customization. So, for example, in Kansas City, Kansas, although we have certain vital signs of instruction that we would look at across all of our schools to help them track whether they're making progress or not, there are also customized opportunities for them to measure the things that they're specifically working on that might be different from what it is or in addition to what we're doing with First Things First. But we are strong believers in trying to take measures, and that teachers as professionals and educational leaders as professionals need to have data not just on the long-term outcomes like the graduation rates and the test scores, et cetera, but also need measures of the quality of relationships. They need measures of the quality of the kinds of the ways in which time is being used in the school, the quality of instruction that goes on in classrooms every day, and that by using those data, that mid-course corrections can be made much more rapidly. So our measures are a mixture of things that we bring to the table based on our experience across all of these different schools, as well as measures that the schools themselves design to incorporate the specific kinds of reforms that they're implementing. But it is a very high, as Mary will attest, it's a very high data-focused approach, because we feel like that the professionals in the schools deserve to be seeing quantitative, when possible, estimates of how it is they're doing so that they can make the changes they need to make sure it's being most effective.